Today on AllForBabies, we explain when the first symptoms of pregnancy appear and what they are. Let's get started. When do the first symptoms of pregnancy manifest? Every pregnancy is different, but generally, the first signs usually manifest between the second and third week after conception, that is, between 1 and 3 weeks after ovulation and having sexual intercourse. Symptoms of the first month of pregnancy. The possible symptoms you may experience during the first month of pregnancy are as follows. In the first week, there is an increase in whitish and milky-looking discharge, odorless and caused by an increase in hormones. It is also common to experience fatigue. In the second week, digestive discomfort, nausea, and vomiting may occur as a result of hormonal changes, as well as breast pain and sensitivity, and diarrhea or constipation. Next, in the third week, heartburn, indigestion, flatulence, and constipation may appear because high levels of progesterone slow down intestinal transit. Tingling in the stomach, a somewhat sharp hunger-like sensation, pain in the lower abdomen, and changes in pain in the breasts are also usually noticed. In the fourth week, pregnancy hormone levels begin to increase, which can cause some early symptoms such as exhaustion and drowsiness, more frequent urination due to increased blood flow to the kidneys, morning dizziness, headaches, and mood changes. It's important to note that these symptoms may vary from woman to woman. Some may not experience any symptoms in the first weeks of pregnancy. It's also essential to consider that these manifestations are not experienced simultaneously or in the same order in each case. There could be weeks where certain symptoms repeat. What if the first symptoms of pregnancy don't appear? The absence of the first symptoms of pregnancy, such as nausea, breast tenderness, or fatigue, is not necessarily cause for concern. Every woman and every pregnancy is different, and not all experience the same symptoms or to the same extent. There are several reasons why you may not experience common early pregnancy symptoms. First, every woman reacts differently to the hormonal and physical changes of pregnancy. Some are more sensitive to these changes and experience symptoms, while others do not. Also, in the early weeks of pregnancy, levels of human chorionic gonadotropin hormone may be low, which may not be enough to trigger noticeable symptoms. Symptoms usually intensify as hormone levels increase. Additionally, even if you have experienced symptoms in previous pregnancies, you may not necessarily have them in every pregnancy. On the other hand, pregnancy symptoms can be masked or confused with other health issues such as stress, fatigue, or gastrointestinal diseases. If you don't experience pregnancy symptoms and are worried, it's a good idea to speak with a healthcare professional and take a pregnancy test to rule it out or confirm it. See you in the next AllForBabies video.